Hi, my name's Jasmine, and the topic I chose for my research was teen drug abuse. So, to start off, I'm going to define what regular drug abuse is, which is when an individual builds a habit of taking illegal drugs. And then teen drug abuse is when teens, typically 13 or older, are using illegal drugs. And this is actually more common than adult drug abuse, which leads into why this is important to public health. This is important to public health due to the statistics shown. The National Center for Drug Abuse statistics have shown that 1 in 8 teenagers partake in substance abuse and start as young as 8th grade. And then 11.2% of overdose deaths are 15 to 25 years old. And in addition to that, because of their young age, this can cause great damage to their health, such as impairing their growth and development, or risky behaviors such as unprotected sex, or even health problems like heart disease. And so moving on to epidemiological facts. To start off, we have incidence. And incidence is defined as all cases both past and present. And the NCDAS's data shows that 50% of teenagers have misused a drug at least once, and the most common substances are marijuana and prescription opioids. For marijuana, this is the drug of choice for college students, and 43.7% of young adults have tried it at least once. And as for opioids, this is an emerging drug for both adults and teenagers, and has been declared as a national public health emergency as of recent. And fun fact, out of all 50 states in the US, Vermont has the highest percentage of teens who have abused drugs, with 14.65%. As for mortality, according to a study conducted over a 20-year period, the average age of death from drug abuse-related mortality is 23. But majority of deaths occur between the ages of 15 to 29. And a majority of these deaths are also due to accidental poisoning, which, such as using heroin or morphine. And it's also been reported that the mortality rate for females is actually higher than that of a male. And females show a 21.2% mortality rate, while males show 10.7%. But overall, there has been an increase of deaths for both genders. And for prevalence, this is defined as cases only in the present. There was a survey conducted by the University of Michigan during 2021 that showed there has been an overall decrease in drug abuse, in teen drug abuse, and 2021 had the largest one-year decrease since 1975. And so, as you can see on the graph in the right, it shows that for 8th graders, 10.2% of them have participated in drug use, and there's been a 5.4% decrease. And as for 10th graders, 18.7% of them have participated in drug use, and then there has been 11.7% decrease. And then for 12th graders, 32% of them participated in drug use, and then there's been a 4.8% decrease. As for disparities, there's not much on disparities, but as mentioned before, there is a higher percentage of female deaths than male deaths, but overall, both genders have shown an increase in mortality. And then as for ethnicity, it's been reported that the most common ethnicity to partake in teen drug abuse, is Native Americans, and the least common are Black and Asians. And the Native Americans can be due to their class. They're not as high up in the social class, so that can lead them to a disadvantage. And then moving on into public health prevention strategies. Primary prevention is the prevention of addictive behaviors in the context of teen drug abuse. And so some strategies include observing your child and having a conversation with them to know when's the right time to start talking about, drug abuse and substance abuse to your child. And also, physicians should look out for children raised in a domestic violence environment or have parents that may partake in substance abuse, because these children are more likely to abuse drugs in the future. And you can also enroll your children into prevention programs such as STAR and POSIT. The STAR program gives it is a great prevention program that kind of teaches children how to avoid partaking in risky behaviors. And then the POSIT program is a 139 question survey that's given to students. A lot of physicians use this for students so that they can answer questions about whether they've partaken in substance abuse. And as for secondary prevention, this is defined as revealing potentially harmful substance use prior to any symptoms. And some prevention strategies include and secondary prevention includes addiction. There's an added element of addiction, which is something that can't really be cured, so that's something to keep in mind while we're dealing with teen drug abuse and using secondary prevention strategies. So some strategies do include therapy or frequent counseling, which is quite common. And then another thing is that physicians should avoid withholding certain drugs from patients that might need it for other health issues, such as opioids. It might make the symptoms worse or their reactions worse when you withhold a drug that they actually need for a separate health issue. Lastly, for tertiary prevention, this is defined as treating medical consequences of drug abuse and further minimizing any disabilities. So some strategies for this is same as the secondary prevention, therapy and programs. And one program that has seems really helpful is the Substance Abuse and Mental Health Services Administration National Helpline. This is a national helpline that you can call, and they will offer free treatment referrals for individuals/families dealing with substance abuse, and they're open 24/7. So these are all my references, and thank you for listening to my presentation.